Attention students, welcome back from break. To start off this unit, we will be going over the newest medical specialty. This specialty was founded in the year 2021, in which we all know was the time of the COVID pandemic. And this specialty is waiting room medicine. This specialty was founded because hospitals were at crisis capacity and they had critical staffing shortages. The ER rooms themselves were full of inpatients. We called them boarders. Some patients were waiting days to get a bed in the hospital. It's not that there wasn't room in the hospital, there was just no staff to take care of the patients. Excuse me, Professor, I have a question. So where would the emergencies go in the ER when there's no rooms for them to go to? Good question. A lot of the patients we saw in the hallway, but most of them we would see in the waiting room. Now you see why we call it waiting room medicine? The first topic that we'll be going over today is how to do a physical exam in the waiting room. So many of you are used to doing a physical exam on a patient when they're in a patient gown like this. Well, in waiting room medicine, a patient's not going to have a gown on in the waiting room. The patient is going to have on their own clothes, and depending on the season, they could have on multiple layers. In the winter months, there's no doubt your patient is going to have on multiple layers like Joey. Good luck trying to listen to a patient's heart and lungs and do a good abdominal exam when they're wearing this many layers. That's all the time we have for today. So next lecture we'll finish this topic and then we'll start a new one, what positions you'll find your patient in the waiting room and what to do. Your patient may be in a wheelchair, they may be sitting in a chair, standing up, laying on the floor, they could be rolling around. What are you going to do?